Thank you, Dr. Simi Singh and Dr. Mani Singh Asad and the whole in the team. It's a very nice session from Dr. Mani Singh Asad. Thank you. Good evening, good afternoon, and good morning. This is the 2021st day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Jolie. Let us begin the session with 1 minute's silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends without paying any money. And you can ask them to share with their friends also, even whether they are homeopathic lovers or students or doctors, it doesn't matter. But the purpose of this forum is to take homeopathy to every home around the world. And we are already up. We have already uploaded more than 3,500 videos so far in YouTube. And those who missed the session can search it at YouTube, IFBH Homeopathy. So let me come to today's guest. Today our guest is Dr. Jolie Janardhanan, and she is a former Supran Homeopathic Hospital, a government homeopathic hospital, Thrissur, and she has done a wonderful service in government, and she has a lot of homeopathic followers with her, and she has cured some of the brilliant cases during her uh, you know, service time. And even now, she is practicing homeopathy at her home, Payanar near Malathakara, Thrissur. She has more than 40 years of clinical experience, and today, Doctor will be talking about hyperthyroidism and homeopathy. This is a very big chapter. She has started the same with the management of thyroid diseases with homeopathy. And today, the topic of discussion is hyperthyroidism. So we proudly welcome the guest of the day, Dr. Jody Janardhanan. Welcome, Doctor. Yes.
Thanks, Dr. Danish.
Yes.
Thanks all the respected doctors of IFPH platform today. Thank you. Thanks to everybody. Our last class, one of our respected doctor asked about hyperthyroidism. He asked that whether T3, T4, TSH level he asked to describe, because at that time we had not time. Time was over. That is why the topic again we are discussing. The hyperthyroidism is describing from the basic. So in hyperthyroidism, the blood, when we check the blood, T3, T4 will be high. The thyroid hormone is really, or actually, thyroid hormone is T3 only. Then why T4? T4 is the prohormone, and it cannot enter through the cell membrane and perform metabolic action. T4 cannot enter into the cell through the cell membrane, but T3 can enter through the cell membrane. T3 is the active hormone and T4 is the pro-hormone. Then why T3 and T4? T4 is, even though inactive, if there is emergency in the blood, T4 will convert into T3 with the help of zinc and selenium. So zinc and selenium are, even though they are micro elements, they have very much importance in thyroid functions. So always remember that if sufficient T3 and sufficient T4 in the blood, even though hypothyroidism occurring, there is deficiency of zinc and selenium. Selenium is the major constituent of each and every human being's bone and teeth. Selenium, such an important element, selenium. So in hyperthyroidism, T3 and T4 level increasing and TSH level decreasing below normal. Why it happens? T3 and T4 increasing and TSH level is decreasing because there is high production of T3 and T4. How high production of T3 and T4 occurring here? It is not because of the feedback mechanism of hypothalamus and pituitary. The hypothalamus and pituitary are responsible for the beginning to the functioning of thyroid. That production of T3 and T4 begins with hypothalamus and pituitary. Normally means the thyroid stimulating hormone is TSH. Thyroid stimulating hormone, TSH. Thus TSH produced by pituitary gland. TSH is produced by pituitary gland, but the thyrotropic releasing hormone is releasing from hypothalamus. So hypothalamus is the beginner of this biochemistry. So hypothalamus producing thyrotropically releasing hormone to the pituitary, and the pituitary produce TSH to the normal thyroid gland. TSH receptors are there in thyroid gland. TSH receptors are there. So that is the normal functioning of thyroid. Hypothalamus, then pituitary producing TSH, and the TSH stimulating the thyroid gland to begin the production of T3 and T4 with the help of iodine. That we had already discussed, or it is another chapter. Here what is happening? Here, first of all, we are discussing about Graves' disease. Graves is the autoimmune disorder of hyperthyroidism. Hyperthyroidism, autoimmune disease, because of the autoimmune nature, the Graves' disease is in such a destructing nature. It is highly destructive because there is an antibody. We should aware about that antibody. That antibody, what its name is TSH receptor antibody. TSH receptor. There is TSH receptor is there. Actually, it is for what? TSH receptor is to receive the TSH thyroid stimulating hormone from the pituitary to initiate the production of T3 and T4 if there is scarcity of T3, T4. It is a feedback mechanism, normal. But this antibody is a actually that name is that it is a treacherous action. Treacherous action of antibody. We should know in our body also there is so many treacherous actions. We have no other word than treacherous because this antibody mimics just like the TSH hormone. What can we do? Will say that because human beings doing treacherous actions outside. So our antibody also doing treacherous action. It is a treacherous action because it mimics just like the TSH hormone and it stimulates the TSH receptors to produce T3 and T4. Actually, there is no need of T3 and T4. There is enough T3 and T4. All the other functions are normal. Iodine is there enough to produce thyroid hormone. Everything is okay. At that time, this antibody mimics just like the TSH and it stimulates the thyroid receptors to produce more and more, and there is no feedback mechanism because the hypothalamus and pituitary are not aware about this. This antibody means antibody is produced by our own body. That is the most painful situation. It is from our immune system. The thyroid receptor antibody is producing, and that antibody is we insisting the thyroid gland to produce without a fear. If higher increasing no more than normal level, normally the TSH production from the pituitary gland will cut down. Then there is no TSH at that time. It will cut down because there is sufficient T3 and T4 in the blood. T3 and T4 are most they are highly reactive and thermogenic because they are the initiator of the metabolism. They enter into the cell membrane. The T3 enter into the cell membrane and it stimulates the mitochondria. It is a power bank of the cell. So it stimulate mitochondria to produce the to initiate to begin the metabolism. Metabolism means excess of heat production, and the body became very energetic. So it is a metabolism means it gives us energy, but more and more energy, what will happen? It is a burn. So more and more energy that T3 producing is actually burning to the body. That is the hyperthyroidism basic problems. First of all, think about iodine. What iodine? Because excessive, what happened there? Thirst, appetite. Even though he is taking all the foods, the patient became lean and thin because of high metabolic rate. So that is the modus operandi going on in our body in Graves' disease. So the antibody is responsible for all these problems were created by occurring in Graves' disease. So in our immune system, there is antibody acting against our own or the organs and doing such treacherous worse. Here the basic reason, do you know what? Why autoimmune natures occurring in a body? Because of the wrong thoughts of the human being itself. The revengeful, the wrong thoughts, and all the melancholic stages, all are created by human beings, are highly affected to our immune system. So, if you want to calm our immune system or our patient's immune system, please give counseling to each and every patient to be calm, whatever the situation. Otherwise, we cannot treat autoimmune disorders. The mind is the base of all diseases. And mind, without a mental derangement, no disease can exist. What our master already stated in organ. Without a mental derangement, no disease can occur. So here also, especially in Graves' disease, there is maintaining cause and exciting causes there. Especially in hyperthyroidism, what the death of sneer are a trigger factor. Even though allopathy, they are not believing in sentiments, they are only materialist. That as we already every time stated, then the practice of medicine in a written that many endocrinologists observed that after the death of near and friends, sudden trigger to the hyperthyroidism. So when we treat hyperthyroidism, we should consider mind. First mind, second mind, then only the symptoms. That is the important of mental state. So counsel each and every patient not to be panic, because it may affect the adrenaline, and the adrenaline will alert all the system to fight against something. But what to be fight against? There is nothing fight against our own body itself. So that's why I think we are observing here. Here in Graves' disease, we have thyroid receptor antibody. That antibody is, another name is long-acting thyroid stimulant, LATS. Both are same. LATS and thyroid receptor antibody are same. And the thyroid receptor antibody is the only one antibody to the Graves and base dose disease, and it is the diagnostic. This is diagnostic antibody in Graves and base dose disease. It is the major percentage of hyperthyroidism. It is the Graves and base dose disease. That is how that name. Graves is a scientist, and he first described about this state that hyper functioning of thyroid, and based on after 5 years described about the antibody also. The antibody is responsible for such a treacherous works going to the thyroid gland, and it affects body as a whole. That is the problem. Even though the problem is in thyroid gland, will it remains there itself? No. The thyroid gland means it is the energy giving, hormones producing gland. So the problem as a whole, body as a whole, and systemic. Here in today is our topic is to find that antibody earlier than the T3, T4, TSH levels begins to change. That is the aim of our homeopathic treatment, that we prevent the further attack. We have so many antibodies. Antibody first releasing from the our immune system. At that time or from that beginning only or beginning, there is signs and symptoms. A physician should analyze each and every symptom and sign of the patient. Then we can understand what is going on inside the body, whether it is Hashimoto's thyroiditis, whether means the hypothyroidism autoimmune, whether it is Graves and base dose disease, the autoimmune disorder of hyperthyroidism, or whether it is a psoriasis. If it is psoriasis case, or psoriasis is also autoimmune. So in almost all autoimmune disorder, there is human leukocyte antigen. When the disease begins to start, there is HLA is the human leukocyte antigen. For psoriasis, what antigen? HLA CW6. For ankylosing spondylosis, HLA-B27. For rheumatoid arthritis, HLA-B-DR3 and B-DR4. All are presenting in our immune system before for more than 5 or 6 years before, which changes in the T3 and T4 in thyroid, and changes in rheumatoid arthritis, RA factor, before the changes in over the presence of RA factor. If we check HLA-B, HLA-DR3 and DR4 before 1 or 2 years, we can diagnose that case earlier and the case will not be getting worse. So that is we are intending to our aim is to diagnose. So the primary aim of a doctor is to diagnose the disease. Yesterday class, iatrogenic diseases. In that, the one of the reason is the wrong diagnosis and wrong medication is the iatrogenic diseases. So each and every physician should be conscious about the patient and there will be correct diagnosis. We have so many tools there to correct to take the correct diagnosis before the symptoms getting worse. How we can conclude or we can diagnose there is when the antibody in the immune system, there will be at that time on begins the reflection of disease. It is a reflection, means we cannot understand first how what is that, which disease, but they are giving some signs and symptoms. So physicians should aware about the signs and symptoms of the patient. If a patient come to a patient doctor and she is complaining about hair fall. Hair fall is for so many diseases. So the physician's duty is to which disease going on inside that patient. It may be hyperthyroidism, maybe hypothyroidism, maybe some cancerous growth, or some due to anemia, or due to vitamin D deficiency. So a hair fall can a differential diagnosis hundreds. So always physician. Nowadays vitamin D 3 level is high, very much decreasing. Almost all patients with severe bone pain and hair fall, when we check only vitamin D below 50, but vitamin D should be 30. So at that time when a hair fall complaint, the physician should aware about all factors, whether she is anemic, whether she is thyroid, almost all thyroid cases are not at all diagnosed correct time. They are drag on. That is why in the homeopathic physicians and the patient should aware about the internal changes should be described to the patient doctor correctly, and the doctor should analyze that symptoms correctly. Then with the antibody testings, we can very early we can diagnose the case, and before the case getting worse by severe signs and symptoms and the no, T3 T4 changes, we can understand what is going on in the body. So here what is the important identifying symptoms of hyperthyroidism as we are discussing here only, because there is we are already told that Graves' disease is a very severe and heat producing disease because of the high production of uncontrolled production of T3 and T4. Here what is going on? That signs and symptoms of the patient we can there is always reflections of symptoms. So first what is we will think about hyperthyroidism. Usually that again I am describing or I am quoting from Practice of Medicine Davidson that hyperthyroidism usually develops insidiously. Means what each and every word there is a elaborate meaning is there. Don't read simply as yes, it develops insidiously. But what it describes? What is insidiously? Means it is acting or spreading in a gradual and steady and subtle way. What is a subtle way? Because something is there, but we cannot understand because it is not clear what is it is there. We have to diagnose with that subtle symptoms with our observation. Physician is there should be an unprejudiced observer, and physician should be a keen observer. So we can understand how can understand it hyperthyroidism. It is first, most patients have symptoms for at least 6 months before outer manifestation. The practice of medicine itself caught, because 6 months before all the symptoms will begins to manifest their symptoms. If a physician is a keen observer, he can understand it is the beginning stage of hyperthyroidism. So, but as I told, these hyperthyroidism symptoms are not first diagnosed by a endocrinologist. What is happening? The first symptom of the hyperthyroidism Graves is extreme palpitation and mental irritability, high irritable mind. So, and the patient may be in a psychotic level. So sometimes the bystanders or the patient think that there is going some psychological problems here, and they are consulting a psychologist. I know all these cases that this is all the already I observed all these cases, and the psychologist, after analyzing all the symptoms, the psychologist will refer this case to the endocrinologist by telling that this is the case of hyperthyroidism. Due to hyperthyroidism, the patient is such in a panic level and such a mentally disturbed stage. So then second, what is happening? Some patients with hyperthyroidism always suffering from pruritus, itching. So if that itching, oh, they cannot understand it earlier. So after 1 or 2, 3 month medication, external application, all that itching is not getting cure, they may go to a dermatologist, and the dermatologist may diagnose, because all other problems, that all others are others. There is no psoriasis, there is no dermatitis, but then he will diagnose it as it is a hyperthyroidism, and he will refer the case to the endocrinologist. Then what is the other major symptom of hyperthyroidism is diarrhea. Diarrhea. Whatever the medicines are given by the gastroenterologist, the diarrhea will persist, because the hyperthyroidism, one of the major symptom in the gastrointestinal tract, they are producing severe diarrhea. Then after checking thyroid TSH only, they will refer the case to the endocrinologist. So the diarrhea we should know. If a patient complained diarrhea and no medicines from the gastroenterology is not affecting, we should think about thyroid. So that is why I am telling that even though the problem is in the thyroid gland, the problem will affect almost all the organs and all the system. And there is one thing also, they marked affection in the nail, and the nail may shed out from the bud. That is also one of the major symptom of our hyperthyroidism graves in older age. Older age, if hyperthyroidism is not detecting or diagnosed earlier, that there is severe problem for them. Anorexia is always there, and there is extreme debility, weight loss. All the older age will suffer if not detected earlier. And it may, the differential diagnosis is in older age. What is that differential diagnosis? Is that the cancer of the intestinal tract. It may also loss of weight, anorexia. Then what is the problems in children? Children, hypothyroidism is more. This is rare, but if hypothyroidism occurs in children, then also the case will not be diagnosed, because that what are the symptoms? The learning disability. So the child will undergo that treatment from a psychologist, because there is, what is happening? That he cannot study. All the academic performance deteriorating. The word is that deteriorating academic performance and the premature growth and standard growth. So in hyperthyroidism in children, there is severe behavior disorders and the poor academic performance. So after so many months treatment, then they may check way into the diagnosis. They may at last enter to the proper diagnosis, as it is the TSH level is very, very low. Always think that T3 and T4 level high. There is TSH level always below normal. Below normal. At that time, here, hyperthyroidism, Graves' disease, anti-receptor antibody is there, and the TSH level is below 0.38. Below 0.38. And other values are here. next class, I will present the slides today because of some subject. This subject has to be explained. That is why today I am not presenting slides. So we discussed about the hyperthyroidism and its that reflecting symptoms. So the physician should always a keen observer to diagnose hyperthyroidism. All hyperthyroidism are not graves. It is 60% graves. Other two are what? It is the nodules. So many nodules in the thyroid gland and it causes thyroiditis. It is also producing high level T3 and T4. And then the other very serious state is here is that there is solitary thyroid nodule which is producing T3 and T4 without antibody and without the feedback mechanism of pituitary. There is that solitary thyroid nodule is also highly dangerous. They are producing or initiating the production of T3 and T4 and without a feedback mechanism. So there are so many factors and so many type of hyperthyroidism here, but the hyperthyroidism graves and base dose is more is above 60% in the human population. So the first stage, the treatment of the hyperthyroidism is make that patient calm with counseling. Otherwise, we cannot, if even after medication, we cannot control. In allopathy, what is the treatment in hyperthyroidism graves means they are giving radioactive iodine 1:1 radioactive iodine to the patients to swallow, and the poor thyroid gland will absorb it as because he's thinking that is it iodine. It is iodide and it absorbs that radioactive iodine by thinking that it is harmless, but it is very harmful, and that their method of treatment only, and the radioactive iodine will destroy the thyroid gland and it goes into hypothyroidism because there is the destruction of glands means there is no production. So if there is no gland, however the antibody doing it treacherous works, it will there is no glands, so there is no production of T3 and T4. That is the way of treatment, and at last giving T4 thyroxine to the patient because getting hypothyroidism and lifelong taking of T4. T4 is the administrative form of because thyroxine, and then after removing one iodine, it will become T3 and the action begins. So in the homeopathy, we have so many. So how are most severely affected? Exothalamic goiter is the another name for Graves' disease, exothalamic goiter, because there is very severe action in various types to the eye. So we have so many medicines for that exothalamic. One of the major remedy is the iodine, thyroidinum, lycopasvir. Lycopasvir is very good medicine for exothalamic goiter, belladonna, toxic goiter. Recommended dose is 1x belladonna. Then jaborandi. Jaborandi is a very good medicine. But what each and medicine they have a with their concomitant symptoms are very much important. So we can select only one medicine. With that medicine, there should be concomitant symptoms with that thyroid exothalamic goiter. With example is that if we are going to giving a medicine Pilocarpus microphilus or Jaborandi, with that exothalamic, the patient suffers by excessive sweat. Excessive sweat. Even he moves sweat. Then only the selecting point is there. In iodine, exothalamic is there. But what is happening there? Excess thirst, excess hunger, and all the features of iodine. In calcaria carbis, each and every medicine, there is concomitant symptoms. So, considering the mind concomitant symptom, then only we can administer medicine. If belladonna is indicated, highly toxic goiter, belladonna is also indicated, but it is acute. That calcaria carb is the chronic of belladonna. So after administration of belladonna, we can administer calcaria carb because belladonna is the acute and calcaria carb is the chronic. So the drug relations are very much important to select all the medicines. Then there is spongia is there. A very good remedy for exothalamic goiter. Spongia. Spongia means it is from the sea and it is very high rich source of iodine and rostus spongia from sea. So it can do wonders in exothalamic and goiter and respiratory system also. And one of the major symptom of the hypothyroidism graves is that exertion palpitation. When the patient exerts severe palpitation, then the patient will think that it is because of the cardiology, some cardiac problems. Otherwise, they will think that there is because of some lung problem. They are always panic and consult a doctor. So then only the diagnosis will get. That is the major, one of the major symptom is that there is palpitation, exertion. So always if the patient describe a symptom, their problem, carefully carefully hear what that patient is narrating. Is narrating actually a hidden, always a hidden dyscrasia. So we should understand that very early, then only the patient will get early relief. So yesterday, a patient came to me and she had very severe swelling in neck. And tell all the doctors, it is swelling. Check the TSH. The TSH is normal. T3, T4 is normal. Okay, you are swelling and you have palpitation, exertion, alopecia, and getting lean and thin. First of all, check anti-thyroid receptor antibody. Then the anti-thyroid receptor antibody was positive at that case. We diagnosed it earlier. That is why that is the main aim of describing all these hyperthyroidism symptoms. And other one of the major, I am explaining, even though even exothalamic goiter, it goes to. Please explain once again. Are you so sorry? What Abraham White, the doctor, put in that box? Please, Dr. Abraham White, request something.
Yes, those who want to. Yes, doctor.
Doctor, I ask after this class, please explain why this is called as Graves disease. Graves disease. Why we call
Graves is a scientist. He
Ah,
first explained half of this disease. He knows something happening. But
okay.
Graves and Bezos, they got a Nobel Prize. Almost all the invention or from the thyroid are or were they all are honored by Nobel Prize. That is the
Okay.
importance.
Okay. Thank you.
Graves
We will
and
discuss it.
Bezos are two scientists. So always
We shall.
either we can tell Graves or Bezos. But Graves and Bezos is one disease. It is the
Uh,
hyperthyroidism.
we shall discuss it after this class.
Okay.
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 No. You can now you can tell what
No,
your
no.
opinion.
It's a good class is going on. I don't want to disturb it. Please continue it
Okay.
after this. After that.
Okay. Okay. Uh,
Okay.
Let's just wait for the conclusion.
So if any some our respect doctors wants to ask or discuss something, can I conclude now?
Yes. Anyway, the class on this hyperthyroidism was really excellent because people may have a different opinion about hyperthyroidism and hypothyroidism. But whatever be the case in front of you, you have to take the case in detail and choose the right medicine. So, of course, you can also supplement some complementary medicines. Along with the constitutional medicine if required. That's what the session is all about. And Dr. Jolie was able to explain some of the medicines in a beautiful way also, and why iodine is given, because as we all know that iodine is a hot patient and the patient eats well, take food in a good way, but even after taking food in a good way, she is getting lean and slim. That is also one of the symptom of this hyperthyroidism also. Well, it can happen in both cases. What's your opinion on that, Dr. Jolie? In iodine, we can see the patient is eating well, but getting slimmer and slimmer.
Because such a severe metabolic process are going on.
And
There is severe metabolism. There will be severe catabolism. Metabolism, I means anabolism and catabolism is metabolism. So if the T4 and T3 enter in the they are burning all the body's deposits. The protein, the carbohydrate, and the fat are burned out. That is why the patient is always hot, want water. The catabolism is going on the two major portion of the metabolism is anabolism and catabolism. Normally, very low percentage anabolism, catabolism and high percentage anabolism. Anabolism means deposits of all the nutrients. The catabolism means destruction. So when the T3 and T4 is working and severe metabolic disorders, how can all the proteins and carbohydrate retains in the body? That is why through the diarrhea, the symptoms goes the dermatologist, severe sweat. That hyperthyroidism has severe sweat, just like Jaborandi, because that there is severe burning and burning actually going on. Why thyroid gland is keeping out in the neck, and it is not an internal organ. Why? They are only producing severe heat. Then they enter into the cells. They are producing. They are the heat producer of the body, and the catabolism is going on. That is why iodine, natron, all are excessive sweats. Natron is psychotic remedy. And hyperthyroidism because natron itself is a major constituent of the thyroid functions. So that natron became remedy is the natron can very well control. Then here one thing is the natron mure. Sodium, our natron mure is a friend front to the thyroid gland, because natrum allow sodium to enter. Sodium allow natrum iodine to enter into the thyroid gland through sodium iodine symbiote carrier. But potassium iodide prevent the enter of iodine to the thyroid gland. That is why in allopathy, potassium iodide is using. Potassium iodide is administering to prevent. Kali iodide prevents. So in hyperthyroidism, kali iodide is a very good medicine. In homeopathy as well as allopathy, the practice of medicine, Davidson clearly explained that it will not allow iodine to enter. That is there. It is very good, because if iodine not enter, the thyroid T3 T4 prevent cannot produce. That is a good idea. That is a clever idea, because if there is no supply of iodine, how can? However, the TSH receptor antibody works, however the nodule, solitary nodule work, if without sodium, iodine, how can the thyroid gland produce? So cut down with kali iodide. A clever idea, and Animan also. He already an allopathic doctor, and he knows everything. So kali iodide is our best medicine for hyperthyroidism. That is the mechanism of we are preventing. Then we reducing iodine also. That is a good idea. Then the food, and that we how we prevent hyperthyroidism by food, giving cabbage, cauliflower, all the goitrogens are we are administering. Tell them to take so many cabbage, cauliflower, what are prohibited in hypothyroidism, we are allowing the patients to eat the plenty. That what goitrogens prevent iodine entrance into the thyroid gland. So we can cut down the production. Then with our homeopathic medicines, we can very safely manage as there is as every doctors know that medicine chapter next time, because this is the I am today explaining the symptoms, and the physician should know the reflections of the symptoms very early. One day I was during traveling, one lady told me that I had severe weight loss, hair loss, and I consulted so many doctors. All they are, hey, no problem. Hey, it is not at all a problem. Then I searched Google, and I came to know that I have thyroid. Then I went to lab and I checked my thyroid level was 25 above. Then that a lady that at that time, it was before 15 years, I was traveling with a group. That is why we should diagnose. We should hear the patiently. That is why I am always insist or always pledge our doctor, request our doctors to diagnose. Don't first diagnosis is most important. Iatrogenic diseases are one of the major reasons is improper diagnosis and improper medication. We cannot, the vital force cannot escape. Will, as we know, the lesson. That class, I open in class.
Yes, definitely. That's a very, very good answer, and really worthwhile to watch such a discussion also. Those who want to participate in this discussion can raise your hand so that we will allow you to unmute yourself and you can speak to the guest of the day, Dr. Jolly Janardhanan. Dr. Ambrose, sir, do you want to speak? Hariharan, sir, I think want to speak. So you people are co-hosts so that you can directly unmute yourself and speak.
Thank you.
Yes.
Thank you, Dr. Dhaneji, and congratulations, Dr. Jolly Madam. Very nice. Excellent session. Very good describe the uh, thyroid, thyroid gland and goiter. But there are three engineer in the body. Three engineer. First, electrical engineer. Electrical engineer disbalance.
Okay.
Electrical
Understand.
engineering disbalance. यानी छितजल पावक गगन समीरा, यानी नेचुरल प्राकृतिक जल पानी इलेक्ट्रिक डिसबैलेंस.
Electrolyte, water.
After change the chemical engineering. Chemical engineering is called hormone. Endocrine gland.
Okay.
Endocrine gland disturbance. Endocrine gland disturbance then produce thyroid, hyperthyroid, hypothyroid, and due to disbalance or hyperthyroid या hypothyroid to mechanical engineering disturbance. Body is the part essential organs is the damage. यानी syphilitic nature. First soric nature, second psychotic nature, है ना. तो या there are three engineer bodies in the body. तो hyperthyroid due to that natramur is the best remedy due to emotional cause.
Okay.
Emotional cause is the natramur is the very good remedy. And anxiety, nervous weakness, phosphorus is the very good remedy. Nervous weakness, phosphorus is the very good remedy. And lycopus, thyroid enlargement. Thyroid enlargement, iodine, etc. So very important remedy. Thyroid, hypothyroid, and hypothyroid due to hypothyroid disturbance due to obesity. Cause of obesity. So ficus vesiculus is the very good remedy in hypothyroid. Ficus
Along with the
vesiculus.
exophthalmicus.
So very thanks,
Sir,
Dr. Jolie.
thanks very much.
Thank you,
for-
everyone.
Thank you,
Namaskar.
thank you, Dr. Rambaraj, sir, for such adding something more to the session. And now
Yes.
I'm inviting Dr. Abraham Vaidyan to speak. Yes.
Hello.
Yes.
Am I audible?
Yes, you are audible.
Yes.
Yes, doctor. It was a wonderful session. In the every symptoms. 15 years back, I was a victim of this grave disease. I suffered every symptoms that you narrated. Big exophthalmic goiter, ophthalmos, eyes bulge like a.
We know it, sir, very well. We know it.
Okay. And then I heard that this is because this is called. I was looked like a grave. Then one doctor that it's a grave disease. I believe that, but from today's class, I know that it is from the this name came from the doctor who invented this condition. I verified this. With the AI, and I confirmed your session. So you are very authoritative. I appreciate you very well. Thank you, madam.
Yes, that's
What
kind
can
of.
I say, doctor?
Yes, not only coming forward with appreciation, but he himself was a victim of this great disease.
Yes.
And was required and recovered beautifully back with the homeopathic medicine also. So those who, I think our time is about to finish. Irene sir, do you want to add anything more, or do you want to speak to? Yes, I'm inviting Dr. Anjita to say vote of thanks to the session. Yes, Dr. Anjita.
Hello, I'm audible,
Yes.
sir.
Yes.
I respected Jolie madam. I'm very late to the class, so that I can't attend the class. But I know how much funny and informative your class is. So thank you on the behalf of IFPH for Dr. Jolie madam, and thank you IFPH for always
Okay,
welcome
okay.
welcome her for the classes. And thank you all.
Thank you.
Thank you. Thank you.
Yes, sir.
Anjita
Yes.
is a dynamic moderator.
Yes.
Thank you, sir.
Anjita. So very, very thanks. Ghar Ghar Homeopathy, Ghar Ghar Homeopathy.
Yes.
Thank
Yes.
you.
Thank you, Dr. Anjida, Dr. Jolie Janardhanan, Dr. Abraham Vaidin, Dr. Ambaresh sir, and those who attend the session in this evening. Tomorrow we will have a session from Dr. Hari Kumar, and Dr. will be discussing a very good subject tomorrow. Hope all of you will join the meeting tomorrow at the same time. Thank you all. Good night. Over to the Malayalam session. Thank you all.
Thank you.